Well, Patrick, the list the state created was created so we could get vaccinations to people who are more likely to die from coronavirus. But BMI is a tricky one. It's based off of someone's height and weight, and technically you could be perfectly healthy and still have a BMI that's considered overweight. Under the state's next eligible vaccine group, starting March 29th, overweight people will qualify. The way the state decides if an adult is overweight is if their body mass index is over 25.
It is based on the best evidence we have about which medical conditions make someone more vulnerable to severe illness or death.
State officials say that means nearly 2/3 of Wisconsin's population now qualifies as having a chronic health condition. But in the fitness community, where people tend to weigh more because of their muscle mass, BMI is an inaccurate way to determine one's health.
I do think it's an outdated way, but I think it's also one that attempts to be sensitive. I think a better way is probably a waist measurement or waist to hip measurement.
Garrett Stengel, who owns 9 Round Fitness in Wauwatosa, says while athletes and weightlifters may not be what the state had in mind for the definition of overweight, BMI is likely the easiest way for officials to get high-risk categories vaccinated first.
I think it's at least a delineation that has some merit to say that, yes, unless you are an athlete, which means you are 20% or probably 10% of the population, much of the overweight and obese that our population sees, that our nation sees, really is coming that way out of a harmful side effect of a lifestyle that's not sustainable.
Does the state have a way to prioritize who gets the vaccine first?
Patrick, they are leaving it up to providers at this point. They said that if somebody has more conditions or multiple conditions on that list, they may be prioritized over someone who just has a high BMI. But again, the other message that they want to get out here is that by May, everyone in Wisconsin will likely qualify for the vaccine. So this is a way to get people who are at a high-risk category that vaccine first.